Hi, everyone. Welcome to the Giving Tuesday Speaker Series hosted by Feeling Blessed. I am 𝐼𝐧𝐭𝐢𝐴, and today we have Steve Sosebee with us, who is the founder and president of the Palestine Children's Relief Fund. The nonprofit serves the most vulnerable segment of the population, namely children in war-torn areas of the Middle East, with special focus on Palestine. So it has several programs that provide free medical care to the sick and injured children. And you can support their vision by clicking the link in the description, or you can scan the QR code that you see on your screen. So you can simply scan this QR code and go to their page to donate, or you can just simply go to the link mentioned here. So, Salam, Steve. Thank you so much for joining us today for the Giving Tuesday Speaker Series. As you are aware, so November 29th, which is Giving Tuesday, is also the International Day of Solidarity with the Palestinian people. And in this spirit, the purpose of this podcast is to raise awareness about the Palestinian cause and support your efforts. So I've heard that your team of volunteers and social workers is extremely busy these days. So what sorts of projects is the nonprofit currently undertaking?
Well, Assalamu alaikum, Hamza, and thank you for inviting me. And thank you for the good work that Feeling Blessed has been doing for charities all over the world and the impact that you're having on the lives of tens of thousands, if not millions of children and poor people in need of services. So congratulations and thank you for the great work you're doing. So our organization was set up 30 years ago with kind of two real main objectives in mind. And those objectives are true today, which is to respond to the immediate needs of people on the ground as a result of the circumstances and that they're living under, whether it's the conflict and the violence that children experience in Palestine every day in the West Bank and Gaza, particularly in Gaza, whether it's a result of the COVID or poverty, COVID virus or poverty that they live under, or the lack of adequate humanitarian services. Our organization was set up to respond immediately with humanitarian programs and projects. But we also understand that we're not going to have a true impact on the lives of Palestinian children if we don't address the fundamental defects and gaps in the health system there, meaning that our goal is to identify what those gaps are, where the defects are, where the lack of services are within the health sector, and address those through training, through providing medical equipment, even building infrastructure. And so our organization has really taken a two-pronged approach: the immediate needs and the long-term strategic goals of developing a more sustainable, efficient, and effective health system that provides excellent care for sick and poor children all over the Middle East, but particularly, as you mentioned, focusing on Palestine.
So again, so that brings me to the next question. So, your name, the nonprofit's name, suggests that you work for Palestinian children, but I've read that you are actively undertaking projects in other parts of the Middle East. So could you please elaborate on the areas or the geographical areas you're currently serving?
Yeah, so when we started PCRF, Palestine Children's Relief Fund, it was during the first Intifada, and I didn't have a long-term real vision about expanding the organization into other areas. But since then, since we were founded over 30 years ago, we've seen two wars in Iraq. We've seen a massive and highly destructive civil war in Syria. We've seen a continued deterioration of the lives of children in Lebanon, particularly Palestinian and Syrian refugees, but also Lebanese children. And we also recognize the needs of refugees and others in Jordan. So as a humanitarian organization, we cannot say that we're only going to help children based on a certain nationality or religion. That would be a form of racism and discrimination. So it's our goal to help any child in need. At the same time, we can focus in a very specific area like Palestine when it comes to strategic development for long-term goals. But when it comes to urgent, immediate relief of providing medical care for children, arranging surgery, providing humanitarian aid, those should go to any child in need in the region. And that includes Syrian children, Lebanese children, Iraqi children, Jordanian children, any child without regard to their religion or nationality. And what we do is we arrange treatment, not free, although we do try to provide free treatment whenever we can. We arrange surgery for children in hospitals and pay for it through crowdfunding activities on platforms like Feeling Blessed. We also provide humanitarian aid. Our field workers, and you mentioned them earlier, are on the ground identifying needs for children, whether it's a wheelchair or medication or whatever that specific child needs. Our organization provides those children, regardless of their nationality or background, the care and support they need. So we have a lot of different programs and projects that exist for children in the Middle East, regardless of their nationality.
And can you share some statistics that, that show the toll on children in terms of injuries, deaths, as a result, especially as a result of armed conflict?
Well, I mean, it depends on which country you're talking about. Obviously, the statistics in Syria are overwhelming. And even before that, when we look at Iraq, and Iraq was under U.S. sponsored sanctions for years because of the effort to kind of isolate the regime of Saddam Hussein. Those sanctions were estimated by the United Nations to result in the death of over 500,000 Iraqi children. Those weren't kids necessarily being bombed, but they're being denied access to adequate humanitarian aid because of the closure of borders and the sanctions that were imposed on that country, which were not really impacting the regime. The regime had the resources themselves to obtain whatever services they wanted, but it affected the poor people in Iraq. So, and you look at Syria with the civil war there and the huge impact in which tens of thousands of children probably have been killed or certainly displaced and impacted by the millions, in fact. And the same, you can go around the region as well, in Lebanon as well. You have a huge impact of children being born into refugee camps without basic humanitarian or basic social services. But in Palestine, where our main focus is because of our work on the ground, we've seen, obviously, as a result, since I started during the first Intifada, tens of thousands of children have been killed and injured in a very small population. We're talking about 4 or 5 million people in the West Bank and Gaza Strip. When you're talking tens of thousands of children have been killed and injured, and many of them permanently disabled, it's just a huge humanitarian crisis. And the health sector there doesn't have the resources to adequately ensure that these children get the treatment and care that they need. So it's important that organizations like ours come in and try to provide some form of relief for those children and to help alleviate the stress and burden on the health system, which is trying its best to deal with just everyday health needs of a population living under siege in Gaza or living under occupation in the West Bank and Gaza Strip. And taking on issues like the coronavirus and everyday challenges that people who live in poor countries have to deal with. So when you compound that with a huge influx of children who are being injured through gunshot and bombing activities or actions, it's just an incredible burden on any health system, and particularly on any organization trying to address those needs. So our organization is taking on this responsibility and working with different stakeholders on the ground there in the health sector on a humanitarian level to ensure that any child who needs care or any type of humanitarian aid, not just medical treatment, because we have kids who are paralyzed, we have kids who are missing limbs, and there's very little that a doctor can do for those children. But there is a lot that a humanitarian organization that can do for them: rehabilitate them, provide them the basic needs that they have every day to get by and to live a better life and a better quality of life on a humanitarian level. And that's what our organization does as well.
And I assume that, so you mentioned, how many kids are suffering because of this, but I assume that there are a lot of undocumented cases as well, because nobody's actually doing the research here. And I think this itself is a huge undertaking, because you don't know what is the total toll on the children.
Yeah, I mean, that's a huge challenge, is that getting that adequate information and data in place. We're now building an electronic medical record system that will help improve the statistics and data for our organization to function in a more efficient and organized manner, but also in general to provide us data as to that we can document where there is a higher incidence, for example, of injuries, where there's a higher incidence of congenital malformations or diseases or needs. And then we can direct our resources towards those locations. If, for example, in Jenin, there's a higher number of children who have club feet or heart disease, then we can send doctors there to treat those kids and not misdirect our resources in an area where the need isn't as high. And this will be based on statistics and data. And that will be the first organization to have this kind of infrastructure in place that enables us to have that kind of information based on science and based on data. But I think your greater point is that there isn't any centralized data system now in place that documents all of the children who are being injured or who have medical conditions that need treatment. It doesn't exist. We wish it did. It would make our work a lot easier, but unfortunately, there isn't a centralized data system in place there.
We're talking about areas that, they're war-torn areas, basically. There's a lot of conflict going on. So how do you, at PCRF, how do you manage the teams over there? Because, their lives are at risk. So, and I assume that, it will have additional costs in terms of, providing them with security, providing them with the proper place to stay. So how is it challenging because, you're in the area, which is, frequently it's bombed, it's, you have these armed conflicts. So how do you manage all that?
Well, that's a good question. And a lot of that comes up when it's not even, like, for example, we have a doctor now in the Gaza Strip doing surgery and doing needs assessments in the different departments in urology in Gaza. And when he went last week, the situation was stable. I'm not going to say normal because Gaza is not a normal situation, but it was stable. And today, the whole situation is becoming very, because of some different circumstances in the West Bank, Gaza now is on high alert, and there's a high risk of the conflict spilling back over into Gaza with, continued bombings and further closure of borders and so on. So for an organization to function in this kind of unstable region, we have to be prepared to manage all different circumstances on the ground there. And to deal with changes in security that happen on the ground. Our staff, of course, and the safety of our volunteers is our highest priority. And we want to make sure that we do all we can to protect and ensure that people are safe. When there is, of course, bombings and conflict on the ground in Gaza, for example, we don't ask our staff to put themselves in danger. Even our office was bombed in May of 2021 in Gaza, not on purpose, but it was completely destroyed by an Israeli missile strike. Our staff weren't there because we asked them to stay home, thankfully, during those bombings. So nobody was injured. The most important thing, obviously, you can always rebuild an office. You can't bring somebody back who's been killed or, sometimes permanently injured. So safety is the most important priority for us, and being responsive to the conditions that change every single day on the ground in Palestine is a huge challenge. We have to be on top of things on a regular basis. We have policies and procedures that we follow to evacuate volunteers who may be in areas of conflict in which they are at risk. And we also have policies and procedures in place for our staff to protect them and ensure that we take every measure possible to not put them in harm's way.
Okay. And what types of resources, physical, digital, or otherwise, are making a real difference in your efforts?
Yeah, I mean, when we started PCRF 30 years ago, there was no internet, there was no laptop computer, there were no cell phones. And the revolution in technology, and obviously feeling blessed is part of that as well, has transformed organizations like ours. It's made us more efficient. It's made us more effective. We're able to communicate, and communication is the key. Also, not only internally for our organization to communicate, we have offices all over Palestine, from Jenin down to Rafah in Gaza. Some of those people have never met each other, staff who work together in the same organization for 10 years. They've never met each other because of the closure and the inability to move around freely in Palestine, but they do know each other through the use of technology and communication. And so we've built a very strong platform in social media, but also internally for communication. And what it's done is not only enable our internal communications to build an organization where people are connected and they're not working in silos, but more importantly, to share the work that we're doing with the outside world and present our work and the impact that we're having with stakeholders all over the world. People who are concerned about this issue want to look for a highly effective, highly efficient, transparent organization on the ground doing good work and helping children. Well, it's not hard to find now. How hard would it have been before technology enabled us to share communication? It would have been extremely difficult, but now you can search and find organizations like PCRF through platforms like Feeling Blessed and be a part of changing and transforming and saving the lives of children in refugee camps in Gaza or in Lebanon or from Syria. And that's a huge, huge change in how humanitarian work is structured, how organizations are structured, and it gives donors and it gives volunteers and it gives stakeholders outside an opportunity to be more connected to the work of organizations they support, to feel more confident that their money is being used in the most effective and efficient way, and to ensure that organizations are doing what they say they're going to do, and not there's a higher level of transparency and accountability for organizations to function at with the use and the advent of these various platforms and technology.
Yeah, certainly at Feeling Blessed, we really appreciate all that you do for the Palestinian people. And so my final question is, so if you could broadcast one message to all your donors, all over the world, what that message would be?
Well, thank you. First of all, as you mentioned, on Tuesday, it's the International Day of Solidarity with the Palestinian people. And I've been serving the Palestinian cause for 35 years now. As a journalist, as a humanitarian activist, and as the founder and head of the Palestine Children's Relief Fund. And the one thing I always want to convey to people all over the world, whether you're Palestinian, whether you're Muslim, whether you're somebody who cares about justice and equality and freedom in the Middle East and in Palestine, it's very easy to become disenfranchised and frustrated with the lack of a political solution to the Palestinian issue. And we don't see any political solution coming anytime soon. We've seen elections in Israel. There's no process coming forward in which there will be the realization of equality and a Palestinian national identity in their homeland anytime soon. That frustration and that lack of a political solution to this conflict, and that's what's going to end the conflict, a political solution, not a violent one, not a military one, but a political one. The lack of progress in finding a political solution should not discourage any of us from continuing to work and serve this cause in a positive way that can make a change on the ground. We've built 2 cancer departments in Palestine for children who are dying from cancer and have saved the lives of thousands of children as a result, because our donors, these were all grassroots funded initiatives. And it shows the power of the individuals, particularly when we work together collectively to make a positive change on the ground and to transform the lives of people who are living under extremely difficult circumstances. In addition to that, it has a political impact, meaning that people there feel a sense of solidarity. They feel a sense of connection with the outside world. And when your children are being killed, when you're living under occupation, when you're denied medication or freedom of movement or equality in your own homeland for generations, it's easy to feel isolated and that the rest of the world don't care about you and your cause and your people and the lives of your children. What I hope organizations like ours exemplify to the rest of the world and to our community, and most particularly to the people living under these very harsh and inhumane circumstances, is that they're not alone, that we do care about their children. We do care about the lives of the people in the West Bank and Gaza, in the Middle East, in Palestine, all over the region, and that we're demonstrating that care and that concern and that love through our work. And we hope people will join us and work with us to continue our mission to change and transform the lives of children who are in need of adequate medical care and humanitarian aid that they otherwise can't get. So don't give up. That's our message. Stay focused that we do have a role to play individually, no matter who you are, no matter where you're from, no matter what your background, there's always a role to play in this struggle that can help change the narrative and change the way that this conflict's going to play out, with all the suffering, with all the violence, with all the challenges on the ground there. As long as we continue to heal and show compassion and love and solidarity with the people there, peace will come, freedom will come, and equality will come. And that's all we're working for.
Thank you, Steve, for your time. And I want to thank the viewers for tuning into this podcast. And, you can donate to PCRF by going to the link. This link is also given in the description, or you can scan this QR code. And I would request all viewers to donate as much as possible. And it's not about donating a big amount, even $1 can make a difference in someone's life. And with that note, Steve, thank you again for your time. Thank you.
Thank you, Hamza, and thank you again for the good work that you and your colleagues at Feeling Blessed are doing. God bless you.
Thank you.